Hi, folks. Pierre-Yves Joffard, member of the Cercle des Économistes. Welcome to this session. We're going to talk about health care, care, organization and financing of care, healthcare. So we have around us a very nice panel, quite diversified. Mireille Weber will introduce everybody to us in a few minutes. And we're going to take advantage of this diversity to cover a lot of topics, but there's so many questions that are raised here. We're going to talk about access to care, important topic. We talk a lot about the rupture access on drugs, medication, ordinary medication, very important, sometimes old drugs, but is the answer to relocalize the production? Should we relocalize the production of certain steps of the production chain which are produced elsewhere? Problem of tariffs, tarification, cost, prices. Should make a distinction between mature, innovative, and old medication. Is the access to innovative medication as good as it should be, or as it could be? To that extent, are the problems related to costs and tariffs? We have an access system to innovative drugs which is complex in France, with sometimes lead times to access the official market which is longer than in certain countries, but with an access with early access which does take care of some of the issues. These are the topics that we will cover. We talk about innovation. Innovation is not only on drugs, but there are a lot of innovation on drugs. In the later years, we have a wealth, a richness of the new medication that really cure pathologies that we couldn't address 5 or 10 years ago. But it's not only medication and drugs, but there's also the organizational change, which is the challenges with AI and the avalanche of data, which can be useful to think better of the care system. Data that is not always accessible to all the operators, that could use them to improve their practices for the service of the general interest. And in the organizational evolution, there's the organization of care with here challenges and that are numerous, the development of chronic pathologies, the articulation between the hospital and city doctors, for example, with the evolution of medication and drugs. But we also have organizational evolution with development of healthcare centers, reflections on the organization of the different healthcare professionals. We talk about the articulation of healthcare professionals rather than talking about delegation of tasks, and not have this top-down approach. So I don't like monopolies. And that's where the challenges are. We see that there are some people have the cold feet when it comes to accept the improvement of competencies, skills, and advanced practices. It's not just we see that these are challenges, but we know the solutions have to be sought. Innovation is also concerns financing. It's something that we often leave aside. But in France, we have a system that is quite original. It's a two-tier system with the public insurance and the mutualist insurance. Do we really reap all the benefits? Do we really use the potential benefits of this organization, public-private, that could bring forth more flexibility, more agility in the system? A system that really needs more flexibility. So we'll talk about the articulation between Social Security and mutualist insurance, and two topics that are often very constraining when we think of better efficiency of the care system is the principle that care expenditures are annualized, especially for Social Security. So we always think that it's an annual planning while the stakes are pluriannual if we talk about the care for chronic diseases and things, and the silo type of financing. We have an envelope for the hospitals, an envelope for this and that. Yeah, and it's an hindrance to flexibility and agility and to efficiency at the service of guaranteed access to health for all. So nice introduction, Eric. Thank you. I'm Mireille Weinberg. I'm chief editor at Capital. And I'd like to introduce you to our panel. To my right, Eric Nami, who is the president of April. Let's say, ensure you supply services to other insurance companies. A lot of people use your services in 20 countries. Eric, you are more a legal specialist in the field of insurance, but you've really climbed up the ladder and you're now holding management positions. And next to Eric, we have Eric Chenu, the president of the Fédération Nationale de la Mutualité Française, so the French mutualist insurers, the administrator of the Vive and Gen groups, which are really very big mutual insurance groups. You're involved in that sector for 25 years, and you also held the leading position in for physically disabled people. You know that the mutualist insurance are funders, financiers, so they reimburse the health care, but they're also health operators because they have health centers that they manage, health centers, hospitals. And next to Monsieur Chenu, we have Sophie Boissard. Sophie Boissard, you're the general manager of the Clariane Group, Normalienne, and you did the ENA school. You've held positions at the State Council, the Ministry of Labor in Bercy, and for 10 years now you have been at Clariane. Clariane is an essential actor in the healthcare system, 666 retirement homes, pension, 517 health centers specialized in mental care and rehabilitation care. Next to Sophie, we have Olivier Laureau, the president of the Servier Group. Monsieur Laureau, you joined the Servier Group, which is governed by a foundation in 1982. You climbed up the ladder, you began at the legal department, and you're now the CEO, president of the Servier Group. You're also a member of the G5. It's the grouping of the largest French laboratories. You take part in all the European instances, international relative to drugs and medications. Servier is one of our largest pharmaceutical laboratories. You're a leader in hypertension or rare cancer. Laurence Perrault, Madame Perrault, you're the director of the LIM, Federation of the drug industry. You have experience in bank, insurance, agro-food business. You spent some time at Roche, and now you're the general manager of the LIM, in charge of representing the French laboratories. And that's all. This is it. I will address my first question to Mrs. Perrault. Now, in terms of sanitary sovereignty, 75% of the molecules are produced elsewhere in the world. The French discovered that during COVID, and the second quarter of 2020, India decided to close its borders and it stopped exporting its molecule of paracetamol, aspirin, and there was a shortage the world over. And we realized a lot of things were manufactured in India and China. And so we have to reconquer our independence and sanitary sovereignty. How, since COVID, we managed to change things to that effect? Thank you for your presence. Good question. When we look at, since the COVID, where at that time we all said, the state and companies, we had to rethink our sovereignty. for all the strategic sectors. So for 4 years later, the Rencontres d'Aix are on the topic of shock of realities, on the policies of health and medication in general. We haven't any planning laws to that effect, while in Europe, and for reasons we know, we are capable at the European level to give more thought on cooperation to for defense. But in terms of drugs and medication, I represent 300 very nice companies, sometimes small companies that produce the oldest products to the largest international groups which work on innovative products. We have very different interests, but very much converging, because we have, and it's our reason of being, we need to ensure you French people, French citizens, and elsewhere in the world, that all patients get the proper treatment. And it's a challenge of your question on sanitary sovereignty. There are more than will we be able tomorrow to relocate the whole production in France and Europe? Yes or no? No. Okay, do we want that? No. But developing cooperation and reflecting on strategies to see where are the medications that are the most critical. We need a programming law to make. We need to make choices, and we appeal to the government and the president. They considered us as one of the strategic sectors of France to work on a future legislation. The good news is that we were able, thanks to collective intelligence with all the laboratories committed and the Drug Security Agency, after the shortages, we can say that today we've gone back to a situation prior to COVID, so we're now at an acceptable level, even though there are certain therapies that are under tension. Why? Because there is a fragility of the production system, and I will conclude there to say that there are three ways of addressing this. We're not here to complain. We're here to think of how we can work differently together. If we continue the same as we did in the past, we'll have the same result. We know there's a big topic on the competitiveness of France. It's a question of attractiveness in terms of health. So we have to encourage companies to invest in France, convince them they should invest in France. A figure that struck me when there were the U.S. announcements. They announced 250 million euros in the U.S., which is the priority market. So how do we really give the will to reinvest in France while these billion euros are invested in the U.S.? So it's a real issue of competitiveness. And second point, we need to invest in research and production. Another figure that I would like to mention, when you zoom out of France, in Europe, 20% of the clinical trials are done in Europe, 80% in the US and Asia. Why it's an issue, why it's a challenge at stake to recover innovation is what you invest in clinical research, you invest in the hospital, you invest in the territories, and you invest in the production system. So it's a major stake to rethink, to review research and production are very linked. And the third point for this third part, there's the question of methods. France has the deficits we know, the debt level we know. We have to be able to work in closer collaboration with private and public sectors. They shouldn't be considered as enemies. It should be sectors of activities that are working together. In terms of efficiency, we make a lot of propositions that cost nothing for the patients and nothing to the state and enterprises. It's a win-win-win situation. That's why we decided to start working on contracts, because this method will give us the necessary leeway and breadth. Mr. Leron, you serve an international group. How do you how do you implement this sanitary sovereignty? And do you think that this, we understood what Mrs. Perrault said, it's not a national cause. How can we organize things in Europe? Well, first of all, I would like to talk about a few facts and then go back on the principles. A few pharmaceutical groups, among which are the leaders, have a turnover of 3 to 5% in France, and so the rest of their income is 95% internationally. We generate 33% and 97% abroad. But we create value in France through research, production of active elements. So these are figures, and as Laurence just mentioned, I think we have to work on the long run. What characterizes the industry of medication and drugs? It's a highly capitalistic industry. We will invest significant amounts of money before a drug is made available to the patients. For 10,000 projects we will have one that is successful. And the cost is between 1 and 10 billion euros depending on the therapeutic domain. So the predictability is really essential today. The health budget are voted on an annual basis. They evolve. I'm thinking about special tax incentives, and the pharmaceutical industry is the industrial sector that has the highest sectorial taxation. In Europe, it's very high. So we need to have more predictability because we're working on long cycles. Our industry is very, very highly controlled, and it's an industry that's at risk because it can be that at the end of our development studies we decide not to launch the product on the market because the benefit risk results are not good. So a lot of parameters that explain this will to have this long-term vision. On sovereignty now, we have 3 strong pillars, whichever country you're in, which give rise to a very harsh competition. So there's no multicultural, bilateralism, multilateralism, so innovation. It relies on simple parameters. To innovate, you need talent and extremely attractive, innovative clusters with passionate projects, attracting people from the world over. We have 22 different nationalities in Saclay in our research center, people coming from the world over. The richness of this diversity is at the source of our innovation. But you need strong clusters, not too many, otherwise we will lose our attractiveness. Look at what's happening in the US. Boston, San Francisco, a bit New York, but if you go to China, you have Shanghai, and a bit in Beijing. Very few clusters, but extremely strong clusters to attract talents. That's the first thing. The second thing is you need to you have to like taking risks. I think we've lost this taste for risks. I'm thinking of all the biotechs, which when they pass the Series A, they leave Europe because they're not accompanied financially. So the financing must be there in Europe if you want good biotechs, if you want patents in Europe, innovation in Europe, for patients in Europe, for the sovereignty of Europe. So for this, the financing has to be accompanied with tax incentives, risk incentives. So the third thing that's very important on innovation, it's the speed. The speed will be based on AI more and more. And I will, of course, answer your questions if you have. We have to be faster in our selection of projects, faster in development. Concrete example, when you carry out a study, clinical study, you have to identify the patients and the health centers that have the best profile. And for this, AI would be perfect. So this is for innovation. The second side is industrialization. Do you build a plant when you launch a drug? It has to be built 5, 10 years before. You need the talent for that. It's a risk that you have to take, and we take it. And I said earlier, we shouldn't have the pretension, I think in France or in Europe, to master the 100% of the production of active elements and finished products. Just for reasons of cost, it's impossible because we're not working under the same standards and same regulations. I would say that between France, for a same company, for a same volume, and Poland, between France and Poland, I have differences that are between up to 73% in Poland. Why? The number of hours in Poland is much higher and the hourly rate is lower. And that's a simple reason, access. Also, we'll go back on that later, but you have to go fast. You have to be faster in validating the studies, faster in analyzing the refunding, and rapidity. Speed is a key for sovereignty. Innovation, industrialization, fast access, and also served more and more by AI. Thank you.
Thank you, Sophie Bossard. We're talking about the deficiency of our healthcare system. We can see that there's some issues, definitely. What do you think about this question of management of AI and big data? Is that going to make it possible to relaunch our system? Thank you. First of all, I'd just like to, in continuance with what's just been said, explain some of the healthcare challenges in front of us. Thanks to the real advances, phenomenal advances in terms of research and treatment, combined with amazing advances in terms of miniaturization linked to operations and heart surgery, for example, joint surgery. So today we really have a capacity to heal or stabilize pathologies that used to be mortal. What we're seeing in terms of progress with cancer is really remarkable in terms of immunotherapy. So this is excellent news, and it means that we are going to see life expectancy expanded. And we've managed to see a growth in 50% of the life expectancy since the Second World War. And so this leads to longevity and aging. And so the era we are in today is the era of chronic diseases. That means we have situations which require really acute specialized treatment in specialist centers that can diagnose and offer treatments, and then can monitor at home, or at least as close as possible to the place that people live for a long period of time throughout the lifetime of the patient. And when we look at statistics today, 80% of people over 60 have a chronic pathology, in the sense they take a long-term treatment. And so the issue, and a high percentage also take 2 of these treatments. So the question is, how can we bring these things together with these centers, with specialist centers, working with the best of research and the best of pharmaceutical production, and also networks, healthcare networks, as close as possible to where people live, with these issues around general practitioners today in France who are working with, and a lot of older people in France today don't have access to these general practitioners. So we have this kind of 2 worlds where we can do amazing things, and at the same time, basic treatment to a doctor who's going to make sure that you're generally doing okay and who can communicate with a specialist. This is becoming the prime concern of French people. And so really what we're trying to do is to see how we can put in place a network across France of healthcare centers with doctors, but particularly nurses, specialist nurses, who can offer this support alongside hospitals or hospital centers which have prescribed a particular drug and which offers a backup. And so in answer to answer your question, Mireille, through telemedicine, we can transfer data in a technical way very simply, and we can do a lot more things through outpatient care than before. So today you can have a hip replacement and you can go home the same day and get support from your GP team and your local care team, or other areas that require really complex treatment. And sometimes the miniaturization is making it possible to offer treatment. So clinical and physiotherapy options are really making a significant difference. The other really important issue is what we're discovering today about prevention of significant dependency. There's a center in Toulouse in France focused on aging, and there's a center working on understanding aging, and they're starting to show that with if you mobilize capacities early enough and enough in terms of locomotive capacities of patients, we can help people to have these capacities reestablished and help them to live well up to a late age. And so we need to detect the risks of fragility and future incapacity and put in place physiotherapy, which is not and rehabilitation systems which don't involve drugs but help people to gain in life, quality of life. And so this deep shift between a medical approach that was focused on infections, a really significant surgery, and moving from that to a distributed type of surgery with healthcare professionals working as close as possible to where people live. This is technically possible, but at an organizational level, it really is a Copernican revolution. It means not just a single professional that you're working with, but working with a team. It means sharing data over a long period of time. We have GDPR issues, of course, with that. And we also need to train all healthcare professionals to in this new approach. And we also need to have more professionals than we have today. Not more doctors, but nurses, rehabilitation professionals. Today in France, we don't have enough of these specialists. Thank you very much. Mr. Chenu, it's almost the same question for you. What kind of oil do we need to put into the healthcare system for it to work? And can innovation help us here, or is it not going to be enough? Good afternoon, everybody. Well, innovation will be part of the solutions to ensure the sustainability of our model at a worldwide level. This is essential because a whole number of public health issues are planetary or even just at a European level. And given that the US has withdrawn from the WHO and changes in worldwide governance around healthcare, there's a number of issues. And it's important that at the global level with the different agencies and also at the European level, we develop a number of different issues. And at the national level, this has been said already with this duality between the Social Security system, which is celebrating its 75th anniversary in France this year. We've talked about the importance of aging. This is a significant transition that's going on. The expenses on treatment of people over 75 are 4 times the amount of someone who is 50. But between now and 2050, we're going to see a massive increase in this layer of the population. And we're not training enough doctors today. We're not training enough healthcare professionals. And so if we keep working in the same way that we were working 30 or 40 years ago, we're just going to be managing lack, dissatisfaction, fear, and resentment. And so we need to offer support for chronic pathologies. In order to do this, we need to change the way that we work. There's an awful lot of experiments being done today. A lot of talent is being poured into the organization of the way we offer treatment, being carried out by mutual insurance companies, startups, and different players. But the challenge that we have is that we're really struggling to scale this up in terms of the challenges around assessment and setting directions for public health. We are all expecting players in the sector to publish the strategic directions, and we've been waiting for this since 2023, and we've been waiting for this document for 2 years. We've not had any priorities fixed in this area for 2 years now. So the issue of this deficiency, which is in front of us, the issue of prevention policies that need to be put in place, working across the French territory is really important. All of these issues are blocked at the minute. Laurence mentioned this earlier. Given the fact that we're locked into the budgetary annual approach, but we're not moving forward, and this is a loss of opportunity for our system. In terms of efficiency, we recommend today that if we want to have more shared skills between doctors and paramedical services, and we're going to have to move from local doctors to teams with a whole number of different specialists, including pharmacists and nurses, and we're going to need to share information about patients. This means that we need to give tools to these professionals. We have My Healthcare Space, which is the key data sharing area that exists in France today. We still need to see a development in the legal framework in terms of sharing competencies, but we need to go into a confident approach in terms of data use. We need to make it possible for all actors. If we want to really make an impact, we need local officials, local elected officials need to be able to have access to anonymized data if we want to drive forward key political policies so that we get ahead of public policies on housing, urban planning, infrastructure, etc. Everything that will make sure that people stay in good health as long as possible. 2/3 of health determinants are from outside the healthcare system. So we really need to maintain an approach that is not focused on a cure rather than prevention. And we really need to avoid maintaining that. We need to change and move to prevention rather than cure. What most European countries are doing faced with GDPR and data, of course, we need to fully comply with the GDPR, but other countries are making it possible to use data in order to put in place treatment pathways in a participatory, personalized and proactive way, and that's something that's really lacking today in our country. If we want to manage risk for social security and mutual insurance schemes, we really need to make it possible for people to handle their own healthcare pathway and help them to stay healthy as long as possible. We really do need to ensure that we put this in place. This is absolutely key. And the last aspect is that today there is bad spending. We are spending on redundant treatments that are inadequate, that are not given at the right time. So that means we need to have a better organization by bringing together professionals, by using data to prevent that we don't have redundant repeats of tests that have already been done or scans that have already been done. We are prescribing more drugs than average European countries. This is not useful, and there's a risk, and actually it leads to the hospitalization of a quarter of older people, and also leads to some deaths. And we need to improve the professional skills of all players in the healthcare sector, because we have a number of actors who are often funded by shareholders from outside France, and we need to avoid this happening and avoid them capturing the value. Thank you, Mr. Chenu. So I want to hand over to Eric Momi. You are an insurance broker, but you also have experience with the healthcare system. You are struggling to be close to the heart of the system, but you're operating in a number of different countries and you're working with healthcare systems in other countries. Tell us how you see the deficiencies in the healthcare system in France. Are there things that we could do that we could make it more effective and efficient? Easy things that we could do, yes, but not necessarily in France. So Eric Chenu was just saying that the role of mutual insurance schemes is not to be a funder. Unfortunately, we're really limited. We are a funder, but we are kind of a blind funder, as it were. So this capacity to absorb, our capacity to absorb innovation is really very low. We say this very simply. The social security deficit is around 16 billion at the moment and is rising. So mutual insurance schemes have the requirement to have a zero balance. So how do we balance this out? And sometimes this works in France. So a good example would be the healthcare networks that you were referring to, particularly around optical care and opticians. Why did this work? Because we set ourselves very clear objectives of taking care of patients. And here we don't just mean a question of access to healthcare, but high quality healthcare. So we have networks where they're working on taking into account optical care. And then the second thing is that we've been given the latitude to go and put in place contracts with healthcare professionals, opticians in this case. Unfortunately, this is just an exception because we really are very limited by the Leroux law in France and also by a suspicion around mutual insurance schemes, where there's a whole number of really valuable and interesting examples in other countries. So in other countries, there are some differentiated guarantees. So I can say to you that I will, for example, your hip replacement, your tooth replacement, I will, the insurance company will say that I will reimburse you more if you go and see your dentist every year. That's a really valuable thing. The second very, very valuable lesson that we can see from elsewhere. So in terms of surgery in the case of morbid obesity, so surgeons come to reduce what needs to be reduced. And we see that if we do this surgery, if we just do that surgery over 18 months to 2 years, 50% of patients fall back into the same situation and they go back to the same healthcare, the same weight that they were in before. However, if we put in place a support with psychologists, with dietitians who make sure that there's not a reoccurrence of the obesity. The third example is really very interesting in some English-speaking countries, such as the UK, Canada, and Australia. So these are support for feared pathologies such as rare aggressive cancers. And so here we have guarantees that is to do with prevention, and the insurer will come and say, I will provide you with capital, will organize the healthcare treatment, organizes the access to the best hospitals and high-tech solutions, and the insurer will also be involved in supporting the patient in order to get care at the right place. In France, we are not in this situation. Everything is in the hands of the state. And actually, it would be really very simple to unblock the system. You can see that insurers know how to manage risks, just like they know how to manage the accounts. Thank you very much, Eric. Mr. Leroux. Everyone, let's go backwards a little bit. Everyone's been talking about AI and data. In your industry, your pharmaceutical industry, how important is this, and how can you adapt this to create efficiency?
An example, to go back on what was said earlier, when it comes to accompanying the patients in Germany, our product that is in the field of mental depression, we developed a computer solution that is validated clinically that will enable a patient to recover all its cognitive sense, its relation to the others. The mutual insurance purchased by this solution because in their interest, the patient will no longer at home, he will be back to work, and the mutual won't have to take charge of him. And so I fully agree that there be a change in the law with the mutualist insurances so that they can intervene via the doctor or on the patient with solutions that enable to shorten the treatment period. And artificial intelligence, well, inside Servier, the group, we've made a giant leap to be best in class. We're not far from getting there. So what does this boil down to concretely? First, significant investments on research to be able to either pursue a program or stop it. When I talk about research, that's even before we're in the clinical phases. Sometimes we're before the proof of concept, very much upstream. We need a lot of data available worldwide. The more we have AI, the more we have access to this data, which means that there's more openness to the access to data, public, private. You can purchase the data, which is not done in France. In France, we don't share data. We have to look for it in the US or in English-speaking countries where sharing data is accustomed. And with the Association of Patients, we can find data there. It enables us to go faster in the arbitration we have to make, decisions we have to make in our research programs upstream. So thanks to AI, we're capable to do that. You have examples of things we've discovered that were not intuitive, that we discovered with data, on the basis of data? We were in Boston with our teams, and I asked the question, I said, is there one drug that was discovered thanks to AI? And no, there are no drugs that were developed, but it enables to accelerate the programs and make the right choices. And maybe in the future we'll find drugs generated by AI. And development. When you're on clinical studies, multi-centric studies, when a lot of hospital centers worldwide that are involved, what's important to go fast is to identify the patient that corresponds to your protocol. Example, we launched on the market, made available to the patients, a medication, a drug in the field of gliomes with mutations. So we needed to identify those patients. There's no necessary prevalence that is monitored. So thanks to AI, we've identified the patients, the centers, and go a lot faster with a lot of relevance. And third use of the artificial intelligence is that we improve the production efficiency. The evolution of markets is such today, and with our cycles, we have a certain number of active elements, and the time of synthesis is 6 months. Production time is 2 months. So we have urgent orders. You have to be extremely reactive. And so the alliance, production, AI, enable us to model forecast systems and to respond. So these are the 3 sectors in which we use AI. Of course, there are a lot of other fields where we're going to use AI to maintain our position as best in class worldwide. So people said you were talking about the deficit of Social Security back in Franco-French context. So you did a study. It's your job, in fact. Aging is one of your specialty. It's your job to work on aging populations. You looked at the cost of this aging of the populations. Can you talk to us about this study and how you intend to implement things to avoid that it gets out of hand? So we carried out a study by looking at what is the share in health expenditures in France by slot of populations. And this study, by transposing the evolution of French demography and studying the behaviors, over 10 years, we think that we should double the deficit of 16 billion. 16 additional billion, which is the mechanical transposition of what Eric was talking about. That is, a patient over 75 years of age will consume 4 times more than a 30-year patient. It's a mechanical evolution. So once this said, one of the specificity of French spendings, like L'Ariane, were in 6 European countries, in Spain, Netherlands, Italy, France, the same kind of activity. That is accompanying, taking charge of chronic or aging people in health care centers or at home. And if I take the way the Netherlands are organized, they chose, based on this observation, that they chose to transfer part of the care on proximity centers. Medicalized retirement homes, and they preventing the access of preventing having too many aging people at the emergency wards of the hospitals. One day at the hospital costs €1,000, and care spendings we will pay is €50 per day. In the Netherlands, it's €250, so you see the difference. But €250 is a lot less than 1,000 that you pay in hospitals, a day in hospital. So this strategy consists in saying, I strengthen the system and to stay as close as possible to the home of the patients, and by using trained carers who can rely on the hospital structures to benefit from their expertise and have the recommendation, maintain the dialogue with experts, but they manage those nurses and things to stop this evolution. And we think, when we look at the studies, there's some in-depth studies that were done by the Ministry of Social Affairs, by the Haute Autorité de Santé. These studies show that today 40% of the hospital spendings concern people over 75 years of age. 40% in the hospital spendings represent half of the health spendings in France, so it's very high, very important share. And the estimate we did today is that 10% of the hospital days, those consisting in sending to the emergency wards an aging person because there's no general practitioners or no other ways to solve the problem. It represents 10% of hospital days, and we all know, for having been faced with families or whatever, going to the emergency is not the best, optimal solution, nor for the patient or for the system. So in the question of efficiency that you raised, Mireille, we have to address this question, how we strengthen this proximity offer by using trained professionals specialized in that sector, and how we remove the load from the hospitals so that they concentrate on what it's best to do, that is this taking charge, high-level charge. Thank you, Sophie. Mr. Chenu, we mentioned the role of mutualist insurances, which is marginal. We could do more. Everybody seems to agree to work hand in hand. And you, from your standpoint, what do you think we could do? What could you do easily to improve all this? Well, the public authorities need to stop deciding in our place and let us do our job. Eric earlier said, gave a number of examples on what the complementary and mutual insurance can do. If the role of mutual insurances is just to boils down to co-financing or cover for the incapacities of Social Security, but there's no added value. But we do a lot better, and notably play the role of increasing the responsibility of social services, the better use of the health system, and go to the right professional at the right moment. It presupposes a lot of pedagogy, and it presupposes to help people to understand what are the right recommendations in terms of public health. We know today, we see in the US, but also here, the people are skeptical on vaccinations, the questioning of scientific facts, solid things that are solid. There's research behind that, but some today put at the same level scientific facts and opinions, which is very negative for the health systems and for democracy, in fact. And here we have a role to play. And there's a challenge on stake also for health professionals. I insist on that. Can we continue sustainably to have today total freedom for prescription drugs, not taking into account the recommendation of the Health Authority, standards of the taking charge, determined by College of Experts, scientists, doctors. What justifies diabetes being not been taken charge of the same way in Aix-en-Provence or Paris? Nothing. Depending on how trained the doctor is and if there was a medical follow-up. So we can't afford today to continue that way. But there are also the issue of responsibility, you know, how much it costs. With the generalization, the full coverage, the prescribers, patients, we lose sight of how much it actually costs because it's covered by Social Security. How much an X-ray costs, how much a day in hospital costs. So there's a stake here of responsibility if you want to do the right choices. Reorganizing the territory. Reallocating the right competences in the right places and weave this trust between the patient and the actors of the healthcare system. So it's adding responsibility and trust in the actors. If we don't do that, we're heading for major difficulties and probably it will affect the trust in our care system. So we hope that the Social Security will continue to do things we don't know how to do, that the mutualist insurances will do things that the Social Security can't do, and that we can work together in trust with the drug industry on the proper use of medication and drugs, with health professionals to do their job, with social structures to structure the paths from housing to retirement homes to the end-of-life centers, and manage to really personalize, customize the services so that people which are disabled can be served. So it means that there's more trust between the different actors, and that's what's lacking in our country. Just an example. In Sweden, same GRDP than we have, dentists, for example, who welcomes a patient over 7 years of age with a dental problem of some sort. He knows that this dental problem will lead to a problem of masticating, loss of muscular mass, for bad ingestion of food, and so there's a change, and so the person is then sent to a therapist. You know, here we don't handle that. We wait for the person to fall. I think we have to steer clear from that, and we have to trust each other, create the conditions so that people no longer stay in good health, I'm sorry, and make sure that everybody contributes for the general interest. Eric, aren't you under the impression, you know, I read the load-in products, I don't know, charge-in products of social insurance is the first act of to establish a budget of Social Security every year. In this report, we're under the impression that the public authorities want us to be involved, the mutualist that is. Well, there's a consensus on non-essential things, like the responsible contract with the legislator covered, you know, the level of guarantees. No, the real topic is not there. That's not the issue. And Sophie addressed that. That's in the dead angle of public policies, and that is prevention. To be simple, and we talked about Sweden, France at 65. I think it's 50%. 55% of the population in good at 65. Sweden is 20 points over that. If we take the WHO, they have precise indicators on vaccination against papillomavirus, against the flu, the tracking different cancers. All these topics, well, the mutualist insurance can be wonderful relays with the patients because we are in contact with the patients. We do prevention on muscle and skeleton problems. So we have a huge topic with prevention. Santé Publique France estimates that at the scale of 10 years, we can save 15 billion euros of savings by implementing prevention measures. 5 billion on chronic disease, obesity. We mentioned obesity earlier, diabetes. We're victims in France of what we call the problems with diagnosis. In other countries, I have a lot of examples where the diagnosis is done much faster. You talked about high blood pressure and the follow-up. We have 2 billion on cancer with the early tracking. We can talk about tobacco. We can talk about vaccination. With people refuse to be vaccinated. Mutualist companies have a wonderful reputation before the patients, and it's up to the public authorities to simply create the conditions. And believe me, the mutualists, insurances push for that. It's not something that's done in solo. It's a complementary work. We have 15 billion of savings we could generate in 10 years. So it's a wonderful conclusion. Maybe one or two questions from the floor, if there are any. Guylaine Lajoignine. I'm an inventor involved in humanitarian work. I run a company. My question is simple. I think health is very sick. I think we need to cure it. Don't you think it's time, more than time, to have a revolution, a Marshall Plan, to respond to very simple questions? How can I have a taking charge that's adequate, and to ensure that everywhere there's well-being and that we age comfortably? Thank you for this question. I have a proposition to make. More than the revolution, which often doesn't really work very well. So we're actors that are very responsible. I was in Denmark some time ago. They created an incredible committee, which is called the Life Science Council. It's a public-private organization that brings together both actors. They have they take one decision, and the only compass they have is to make sure that it's good for the patient, for everybody. So we need to really have Copernican revolution, because today public and private sector find it hard to work together. I think it's an accident. Before trying to find to make economy savings that will hurt everybody, I think we can find the right solution by working together. Thank you very much. You can ask your questions. If you have questions, you can ask them to the panelists outside this room. Thank you.
Non, ça marche pas. Ah, voilà.
Great, I think the microphone's working. So good afternoon again to all of you. And so in this heat, you might think that this theme might feel a bit arid because AI is everywhere, particularly in finance and in our lives, everyday lives. But it's something that's really important to talk about. And you're going to see this is a really fascinating subject. So in order to present the subject to us, we've got Olivier Pastre, who's written quite a lot on this issue, and he's going to do the introduction in a few moments. And then we'll hear from Marie Brière, who has worked a lot on these questions. She's an academic, as well as working for Amundi Investment Institute, and she'll give us a bit of a presentation of issues around AI linked to finance. Then we've got Jean-Paul Mazoyi from Carte Bancaire, and you'll be talking about the impact of AI, David Dupont-Noël as well, Olivier Perroni from Finexi, and Adami Marseille from Bain. You're going to be explaining to us the issues associated with AI in finance, which are fairly complex and sometimes difficult to assess. And sometimes we we wonder whether actually AI is just going to further destabilize the financial system. Is it just going to generate more fraud, or is it going to make it possible to combat fraud more effectively? There's a whole debate around that. So, Olivier, perhaps I should let you just give an overview of the situation so you can just explain where this whole theme comes from and the impact of AI on finance. Yes, good afternoon. This panel session is going to be the most fascinating of all of these sessions for the Rencontre d'Aix, like every year. This is because we have the best journalists in France and also the best panelists on this subject, which really interests all of you. On the panel, I'm the only one, alongside Nicolas, who's I'm not competent, but I'm not completely useless. I'm here to give you the context. And so I'm going to give you 6 certainties and 6 questions. And since I'm a real coward, the 6 proposals, it'll be up for them to offer the proposals, because that will be what's hardest and is what will be most interesting. So in terms of what's really easy and not very interesting, let's talk about the certainties. So 3 of them are good pieces of news. First of all, artificial intelligence has not developed as quickly as we thought it was going to. There's been an acceleration, but it was originated in 1958 in Dartmouth University, and the principles of artificial intelligence were set up then. So that's some time ago, nevertheless. So things don't always necessarily go as quickly as we might imagine, but we'll come back to that. The second certainty is that machines will never positively fight against people. We can do whatever we want in terms of AI around healthcare. We will always need a doctor. Excuse me. That's because of the air conditioning. We can do whatever we want in terms of finances and banks, where AI is particularly useful, but we're going to need bankers and financiers who are going to hit the button or agree to the loan or do the investment. So let's not be completely terrorized by the arrival of these new technologies. If we compare with the first industrial revolutions, of course, there are at least 3 differences. First of all, even if AI isn't going as quickly as we thought, it is accelerating, and that cannot be contested. And this is different from the other industrial revolutions. The second industrial revolution is the subject of our panel session. It doesn't just impact production, it also impacts intangible elements. And I would say this is alongside finance. Finally, Europeans and the French have not, this is a certainty, they've not understood the importance of this revolution. And here we've got this phrase that if we really go and look at this phrase that comes from the president of MEDEF in Italy, who said with the Industrial Revolution, he said that Americans do business, the Chinese copy, and the Europeans regulate. Everyone has their job. And that's what we do. And we're kind of in that triangle, which is, of course, a bit negative for us. So that's it for the certainties, which are generally positive. There are three negative certainties, which cannot be contested, and I hope that we're focused on that. But AI is increasing inequalities between people, between businesses, between industries, between countries. And so it really is important to understand this. The second certainty is that there's a major issue associated with data protection. When we were preparing this panel session, Marie was saying, well, we know this, but that's rubbish. There is an issue associated with data protection, and that's something that's really very important. The final certainty is that we really need to avoid, it's really essential that we avoid false solutions. If people say that artificial intelligence, I don't care about it, so I'm thinking here of intermediate-sized businesses. We saw what happened in the 19th century with the Luddites in England who tried to avoid progress, but that's just impossible. And then in terms of questions, I've got 6 questions. These are not in order of importance, just in any order. The first question is does artificial intelligence increase risks? And in particular, in finance, does it increase what we'd call systemic risk? This is a key issue. There are questions that I'm asking that don't yet have answers, but at least we need to ask these questions in order to reach the third part, which will be the proposals. The second question is there a difference in the financial world around AI between banks, insurers, and investment funds? I have a sense that, yes, there are different business models here, and artificial intelligence will affect this sector in different ways. And around the table, the theoretical table today at this roundtable event, we're going to try and answer that question. The third question is Europe, as I was saying, that Europe hadn't been sufficiently prepared and it's been regulating. Is Europe beyond hope? I have my answer. I hope there'll be another answer from this session. The fourth question is what regulation is necessary? We need regulation, even though there's too much regulation in Europe, but we need regulation, particularly in this field. So what regulation needs to be put in place? And the last 2 questions are to do with the industrial policy that we need to put in place. What funding needs to be put in place? This is true at a European level and at a national level. There's investment that needs to be done. It's not Nicolas Dufour with his big talk that's really going to sort out the problems. So we need to make investment decisions. And so the 6th question, which I think is probably the most question, is perhaps the most important question, because it's about training. What training do we need? Because we're going to need to draw in professionals. We're going to have to see people changing professions, and it raises the question of training. This is the only way that's going to lead us to put in place a reaction at a political level. And so this is a really major question. So on the basis of this overview, we're not going to be talking about artificial intelligence. We're going to be talking about AI, but we are going to be talking about innovative imagination. Thank you, Professor. From my ignorant position, I just want to slightly nuance something that you're saying. In terms of AI, I'm not totally convinced that the US is inventing and China is copying. I don't think that is necessarily true around AI, although, yes, of course, we do have the regulation role. Marie Brière, what does academic research say in this field? Have we started doing research into this question? They're starting to provide answers around these questions of risks. Thank you very much, and delighted to be here despite the heat. Before we talk about risks, let's talk about the advantage and the benefits, because a lot of us on this panel are actually quite enthusiastic about the progress that artificial intelligence makes possible. Let's come back to the risk, because that's something that's very important, but I just want to talk about the benefits that we can get from AI, particularly in the financial sector, where I think there is increased agility to gain. I think this gives us operational efficiency. You might say, well, what does that matter? But I want to show you that actually there are real social advantages, and society really benefits from this in the financial realm as well, because it really does impact our customers. So what are we going to do with artificial intelligence in the financial field? Well, first of all, it makes it possible to better exploit data and exploit new data. So this is all these alternative data which are not quantitative data. This could be textual data, image, sound. We can also exploit satellite data, and this is going to make it possible to better assess risks and make it possible to better evaluate a financial situation, the financial situation of a business, for example. So that's a very important advantage. Another advantage, it's going to make it possible to access data in real time. So satellite data is now available in real time. Before we were waiting for reports coming out every quarter. Now we have satellites that are measuring economic activity by taking photos of car parks in supermarkets, for example. So we have real-time indicators that are making it possible to get information a lot quicker, and therefore this could potentially make the markets more effective. Of course, this raises a whole bunch of questions. We'll come back to this. Is this information that we are getting much quicker? Is it a very good quality information? Well, that's a question we need to talk about. But this kind of data is going to make it possible to do predictive analysis. We're going to analyze the data of customers in order to think about loans in management of assets, which is what I work in. We're going to be able to assess financial markets and financial rates associated with this data. Another benefit of AI, which is really growing very strong at the moment, is to do with customer relationships. Today, when you talk to a human customer relationship manager, sometimes you're talking to a person and sometimes there is no real relationship. We know that sometimes advice can sometimes be biased, but artificial intelligence is going to make it possible to improve this, either by giving information to advisors, that this will give them the most relevant information that they have on you from the information that you've given them, but also you could also have a direct connection with an AI tool. So of course, some of you we're already experiencing chatbots. But for the moment, we're not yet trying to actually put customers directly in contact with a machine, but that's something that's coming. We're testing ChatGPT and large language models to see whether it would be interesting for them to be customer-facing and whether they're going to improve customer relationships. So that's the second key improvement that I think we can see. Questioner, are you sure that this is progress? I'm not. Of course, we could debate about whether this is be progress, but you can test large language models. They're not actually bad at giving financial advice. The question is to do with fiduciary funds, because actually if they start working directly with customers, that might be complicated. We can also see that large language models can also manipulate us. And so there really is a question of responsibility, because the bank is liable for this responsibility if human beings are dealing directly with machines. But artificial intelligence systems are better than a bad financial advisor, and not everyone has access to advice. I think it's something that's really important. Olivier said this. It's important to talk about this. Not everyone has access to a financial advisor because it costs money. That costs money. So there's a possibility for this to become more general. AI is going to provide tools for people who don't have tools, and I think that's something that's really very important. The third point in terms of operational effectiveness, and this is the most technical part and perhaps the aspect that raises the least questions, but it's true that AI makes it possible to access data much more quickly, to do compliance checks, to check fraud, etc. And all of this adds value for financial institutions, of course. Then we were talking about risks. And yes, there's this question about whether AI is going to create new risks. That's a question that we're asking in financial institutions. A lot of academics are asking these questions, of course. Are there new risks that we might not have imagined? Well, it does make it possible to improve the informational efficiency of the markets, because we get information quicker. And so the prices better reflect the information, and that's important, because if prices directly reflect information, we're going to do a better allocation of assets, and we're going to be therefore able to better spread out money in the economy. But one of the questions that AI raises is that this information that comes from AI may be manipulated. So we know, for example, there are some business leaders here who might confirm this, but businesses don't communicate in the same way, since they've understood that AI is listening to them. AI is analyzing their text because they tend to add words that will be positively interpreted by AI. So there's this risk of exacerbated manipulation, which is exacerbated by social media. So there is a balance in terms of speed and quality. Now we can access data much more quicker, but it's not necessarily of good quality. So this can generate noise and create volatility. The systemic risk would be associated with this volatility, and we can come back to this later.
In
fact, in terms of AI, it can be a formidable tool for fraud. How do you see things? I don't know if it's a new risk for financial institutions, but it's a mean to limit our risks, to limit fraud. I'm sorry, Mary addressed this through the analysis we can do on the granting of credits. We use it a lot to detect the loss of a client, to know if a client will leave us or not. With the algorithms, we can analyze that. There's one field that you didn't mention where AI plays a major role for the reduction of our risks is cybersecurity. And all the companies are equipped today with security centers that analyze billions of logins in real time. It's obvious that it's impossible to do that without artificial intelligence. Artificial intelligence will enable to already enables, and even more so tomorrow, to deal with the false positives and to have a much faster analysis of the attacks and everything that deals with cybersecurity. Another field is the field of payments. We implemented through bank card, or Carte Bancaire, it's a company. I don't want to talk about my company, but just to give concrete examples, we process about 1 billion payment authorizations every month. This billion is analyzed on a permanent basis with algorithms to check if the transaction is valid or not. And we also process 1.5 billion authentications, that is to know if it's the right person who is doing this operation. And we have algorithms and systems that have, in 80 milliseconds, analyzed hundreds of variables for each payment to see if the payment is valid or not. And this enabled to reduce in the field of payments by 15% the fraud rate. And Marie said that it wouldn't be possible. It's only possible if we have the right volume of data. If we have a volume of data that's relatively high, structured, well organized, enabling to use it for large volumes. So I didn't talk about what we have on the customers with the customer relationship. There's a lot of sectors and fields. And for years now, where artificial intelligence, traditional AI, not necessarily generative AI, takes up an important position to reduce fraud. And more, and you said that, we will have tools available that not only will replace the human being, but augment. When I said about cybersecurity, we replace the human, just impossible to have the number of people needed, but in the field of fraud, we also need that to solve the problem, or at least address it. David Deverman, you are director of Deloitte. Do you have a view on all economic sectors? The deployment of AI, of course, it involves colossal investments. Will need to be done. And there's also an issue of sovereignty. Olivier made reference to that. How do you see things from your side? AI, well, we need to is much more efficiency. We have to acknowledge that. Capacity to process data. We already had AI on the basis of data processing and so on and so forth. Limited to analysis. From the analysis, we went to a hypothesis, and from the hypothesis, we moved to the decision-taking process made automatic. We see the influence of AI will have on all our operations. Before entering into details, I'd like to talk about the first risk in terms of financing of AI, is to have the financing needed to implement it. And today, among the major designers of AI, NVIDIA, AMD, Intel, all American. Among the producers of AI, those who manufacture the chips, not a single European. In the 10 leaders, we have the Koreans, Americans, the US, the Chinese. ST and Microelectronics is 12th and 14th producer of these CPU cards. So we see there we are dependency, 63 billion spent in the US in 2023, 10 billion in Europe. But luckily there's a reaction from the French government, maybe a leader in Europe, with this new plan recently published. 10 billion over 5 years, 10 billion a year. We're pretty far from what the U.S. is investing. But today, AI, if we don't have it freely available, what would it mean? It means that we'll have the remaining portion will be totally dependent in terms of cost, price, and usage. First risk, big risk. Second risk is consumption, energy consumption. Data centers today represent 1.54% of the global energy consumption. It's Saudi Arabia. In 2030, it'll be 3%, exponential need for energy. So here, there's an issue of energy dependency. And to answer your first question, it calls for a massive mobilization in Europe. Not to encourage companies. No, we have to build infrastructure. We have to build data centers. We have to boost the European champions who are capable of producing and give to all the European states the tools and analysis. Second point. With finance. Finance works on the basis of trust. And it's an issue of trust here. When you prompt an AI, you do 1 + 1. Well, you say the result is 2. Well, in biology, 1 + 1 is 3. Yes, in biology, 1 + 1 and a child is 3. In management, 1 + 1 is superior to 2. Why? Because being two, you're stronger than two separate units. So, you know, the paradox of AI, how to deal with that. If you talk about these, if you consider that questioning and the questioning of, you see, there's a loss of trust. The loss of trust in the financial system is a disaster. It's chaos. What you need is to have to reestablish trust, and it's based on three things: to have people that are well trained. The government talked about that. And we must, in education, be very proactive there. The second point is to have a control system, government system that is strong, appropriate. You need to have actors that are people that are trusted. And the third point is to have a set of rules. I know we're very strong in regulations, but if there's a sector in which you need regulations, it's the sector of AI. I was talking about a rupture and things, but each time you have a rupture, well, you need to set rules. We had the, you know, when we started dealing with roads, we had to establish rules for cars and things, capital. And the other point in terms of risk is, Jean-Paul, you raised that earlier. It's the risk of seeing the system go wild. You know, on the basis of fakes, fraud, your bank advisor, it's his voice, it's his face and everything, but it's not him, it's not the right person. I mean, it's a deep fake. And, you know, there's a risk of going into a loop. We have a very good example. When you use Waze, Waze, GPS, everybody follows Waze, and in the end, you end up with a massive traffic jam next to the other traffic jam. So you see, when you massively use this tool, well, you may run into problems. So what do we have to do? Well, we have to maintain the relationships. We have to understand, when you automatize all bank transitions, you know, when the AI interact with each other, how can you keep control? How do you maintain control? So you have to be able, for younger generations, even for ourselves, to remain critical. It will be essential before we use AI, and because for me, for those who will use AI properly, the people who will be able to reconcile the efficiency of the tool with this critical and independent view. Those who are lucid enough and who have the courage to keep to their opinions. You know, say it's 90% right, 95% right, but founded on known thesis and scientific facts. And the third point that would be essential is to keep the responsibility, the decision-taking process, who will be responsible, and to avoid delegating to the tool this responsibility. And so I think these are the new risks and new challenges that will affect the world of science with AI. Olivier Perronnet, very good transition, because you work in the field of the assessment of enterprises. So in some cases, can the IA replace, not totally, but in the larger part, the judgment you may have on the value of an enterprise, of a company? Well, this AI will work practically as well as a human being. But so good afternoon to all of you. Very happy to take part in this round table. My question that rises for assessors is an existential question, in fact, because will the machine be able to replace human beings? So being an assessor will no longer mean anything. The machine can provide a reliable response and everything. So we studied that a lot. We gave a lot of thought to that. It's an existential question. And inside an organization, the International Evaluation Council, who works on these issues, and they are studying the impact AI can have on the assessment processes and evaluation criteria. So first thing that we noted. If you look at AI and evaluation, the evaluation process, everything that leads to give a rating of an asset, of a financial instrument, or what have you. So using AI is, without question, a tool that enables to make big productivity gains. You interrogate the machine, it's capable of discussing with you. You can make it evolve in its research. And it's surprising. And everything concerning the search for information, you know, the selection of parameters, the use of algorithms or complex models, and more generally speaking, for companies who supply data like Reuters and Bloomberg use it, AI is everywhere. AI is everywhere, and it represents considerable productivity gains. It even goes further than that. Whether it's predictive or generative, it can cover a large spectrum of the evaluation process because you can draft reports in human language, and that's what's special. It's this dialogue with the human and the machine, the man-machine dialogue, how the machine can overcome the human. And so the lot of us share our personal experience in the usage of AI. The first thing that we've noted, the first observation when it comes to making recommendations, is that the professional judgment is at the heart of the use of the machine. This was said when we talked about opinions. The professional judgment is the key element. And so the tool that AI represents is a tool. But there's the issue of responsibility for the assessor to use AI to replace him or herself is something that is impossible, not fully. So the use of AI, and that's where the human is very important, gives rise to a lot of questions on the quality of the information. The English say garbage in, garbage out. The quality of the information that can come from AI is questionable, but in any way it must be challenged to be sure it's reliable. I've experimented as a famous case, you know, not in finance, but for lawyers, a lawyer that had pleaded before an Australian court judge talking about case law in Australia, but after doing the necessary controls, this case law was false. It was fake, and so there was a trial of his client with the lawyer for using case law that didn't exist. It was made up by AI. So AI presupposes that the human being using it is critical. And in the assessment job, AI cannot be a black box. This goes back to the issue of responsibility. We can't make the AI responsible for what it produces. We can't imagine our prescribers, whether they're the stock exchange regulators. We can imagine a report. We say, you asked a question, I address this question to AI, and that's what AI replied. It's a good thank you, goodbye, but that's the final result. It's totally unacceptable, or and us as responsible for the assessment for all the people who use AI. No black box syndrome. You can't think. You have to know what data comes in, garbage in, garbage out. So you have to be careful. You have to control. You have to master control the whole process. Another important point in the use of AI, we talked about responsibility, input, output, quality of data. It's confidentiality. In fact, when you're going to be working for a prescriber, whoever they may be, they will give you information, and if you use this information in the AI system, issue of confidentialities are excluded. And so the data protection, so it's clearly a formidable, wonderful tool, but it can only yield its full value through a human usage. As an example, and to conclude, I questioned ChatGPT on definition of professional judgment. Interesting to see the result. because if we all together here we couldn't come up with such a definition by ChatGPT. So I quote ChatGPT: "The professional judgment can be defined as the capacity of an individual, generally in a professional or technical context, to take decisions that are enlightened and appropriate based on its expertise, its experience and knowledge, and also on a rational basis and ethical." So the question I decided to ask ChatGPT is, you ChatGPT, when you give me an information, do you consider that it was subject to a professional judgment and that can be used? And the second good answer by ChatGPT was, ChatGPT is not capable of exercising a professional judgment in the human sense of the word, and a lack of confidence, of trust and responsibility, lack of practical experience, lack of complete contextualization, lack of ethical judgment, and lack of real creativity. So I think everything's said there. A wonderful tool, but it has its limit, because the human being is also a wonderful tool. Thank you. So aware of its own limits.
So, Adam, you lead the Bain company. You help your customers. How do you use AI in your context? Thank you, and good afternoon, everyone. Delighted to be with you this afternoon. So there's an intrinsic bias in the title of the session, where we say that AI and finance equals risk. And of course, yes, I want to say, yes, there is a risk around confidentiality, but the rolling out of AI in the finance sector is an incredible opportunity to reinvent our society. Why am I saying that? Well, because here, this is a personal hope. I've been supporting a client in this journey, which is a technological journey, but is a really fascinating journey where we can see this is a real priority, but we need to understand what it is a priority about. And the question is not the tools, it's not the models, it's not the algorithms. All of that is available, but the question is, how are we going to use these algorithms? And so that's what the work that's being done, so that it is relevant to the existence and the ambition of a company. So we're seeing this change happening. 80% of businesses that are deploying AI at scale consider that it has an impact that's beyond its expectations. And this question of expectations is, we've talked a lot about effectiveness and productivity. Is that the only impact that we're looking for from AI? No. Of course, we're going to have automated tasks, but we've also got new tasks, new professions. We've also got customer experience, customer satisfaction that's going to happen. So when we're at the beginning of the journey, and the maturity is not the same in all sectors, we need to think about why we're deploying this. So this notion of impact is very important, whether it's about agents who are going to help private bankers, and which will perhaps save us 30 minutes. But the question is, what are we going to do with these 30 minutes? And so we need to also answer this question at the same time as we think about how we're going to save time. When we have perhaps a colleague who's not going to have to go into 4 IT systems in order to produce a report, that's going to make it possible for them to better listen to clients, to give better recommendations, to be better concentrated, and that means increased customer satisfaction, and it also means a benefit for society, which is not just about reducing costs. On the other side, there are expectations, but there's also the capacity that AI gives us to think about the future and project into the future. When you work to deploy agents, to deploy staff, the idea is not to say, this is what I want you to do. I want you to do this sequence of tasks. That's not what we do with AI. We work with, that's not what we do with staff. We work with bankers and people on the front line to reimagine how they're going to do things in the future and how AI is going to help them. When you do that, you manage to do what is the hardest thing. You help people to be less anxious about this concept, because when you start these projects, there's a real anxiety in organizations. We need to reduce this anxiety from the beginning with an ability to reinvent what we're doing. That's where AI is going to augment humans rather than marginalizing humans. That's what we do. The third thing is that we need to say, well, that's the micro aspect, thinking about projecting ourselves. But there's also the macro aspect. Management teams talk about all the different things we're going to do. We have a solution X, Y, and Z, but fundamentally we want to think about what are we going to obtain at the end, and it's this question that we're asking. So in order to come back to your question, are there going to be training needs? Yes, there are going to be training needs, but it's not about training. It's about reinventing the capacity to produce economic activities in a new way. So there are things that we will no longer do. There are things that we will do differently, and we have new capabilities which are going to come online. And we all want to have a world in which AI doesn't marginalize people, but makes people better. Thank you very much. Marie Brière, I interrupted you earlier, and you were talking about how you see systemic risks, and then perhaps we'll take some questions. But we've got this question of systemic risks. Sometimes we think about a bank that goes bankrupt in California and leads to a worldwide crisis. Are these tools going to increase this risk, or is it going to make it easier to prevent them? Well, the answer is probably both, but we don't really know today. There's a lot of academic work being done on this, and we don't really know the answer yet. The question really is about whether artificial intelligence models are better than conventional methods. Sometimes here we have some very clear examples with correlation which don't necessarily generate systemic risk. So we have some pension funds in the United States, for example, which systematically transfer assets at the same time, and this is a problem. It doesn't create a destabilization because they buy again when the market comes down. So actually it stabilizes things. But in order for there to be for this to create systemic risk, these different models need to be correlated together, and they need to buy when the market is low. And actually, for the moment, there's no proof that there is a real correlation between these different models. Perhaps there are risks that might seem more important. We talked about inequalities. This is beyond finance, but I think it's important to ask these questions as financial players. We need to think about our impact on inequalities. I have perhaps more measured perspective than Olivier on this question, but I think we have to be very vigilant. Some tools reduce inequalities. So I've been working on this advising robot that gives financial advice. People that take this advice make better financial decisions than when they have no advice, because a lot of people don't know how to invest their money. But one of the issues, and I think that's what Olivier is thinking about, is lots of people don't access this kind of service. This is where AI can lead to an increase in inequalities. Some people are not even going to have access to this kind of service, either because they have an aversion to algorithms, and we know that people with less financial education are more hesitant about these kind of tools, or they don't have access to these tools. And this is why it's really important to educate and train people. And it's important as well that AI doesn't replace us. One of the issues is to use AI to educate people. And in terms of financial decision making, there are robots that automate everything. Is that, i.e., that you give them money and then you don't have to do anything anymore? Is that what we want? That's a question, because actually it might be worth thinking about your finances. And it might be good to educate people using AI rather than simply delegating to AI. We have the same issues in businesses. Do we completely replace some tasks using AI, or do we keep humans in the loop so they supervise AI? And that's where we have this interaction between machines and AI. Thank you very much. Are there any questions in the room now? I think with some microphones around the room. There's a question that Olivier was raising that we haven't necessarily answered, but have you got any questions in the room here? Please, at the back there. Good afternoon. I am a student in economic and trade preparatory classes in Marseille. So I wanted to just raise a paradox. Is finance is based on stability, trust, and international trade, but AI is often unpredictable and very difficult to regulate at an international level. How are we going to integrate AI into a financial system which is based on order and worldwide stability? Well, what a question. Who wants to answer that question? Well, perhaps I could say something about confidence and trust. Yes, this is really very important. The whole financial system is based on confidence. How can we put in place confidence? Well, we can do that by testing, and perhaps that's one of the recommendations. Olivier, you were asking us for recommendations in terms of policies to put in place. I think that we need benchmark systems so that we need to measure the impact of tools. We need to measure the capacities of tools to measure a task. There are a number of sectors where this is the case. And then we need to also measure the impact. I think we need to measure impacts in a greater level, impacts on customers, because we can give people artificial intelligence tools and see how it impacts inequalities, etc. Olivier? Yes, I am both at the same time totally depressed and full of hope. I'm totally depressed because, for people who don't know that, I am from the Camargue region in France, and when I go to a cafe in Arles, I see people and that's the only preparation I've done for this panel session, is just talking with people around me. First of all, people just get really mad, and then they say, well, what are we going to become? This question of inequalities is fundamental. It is the roots of populism that are found here in these inequalities. So I'm really depressed and concerned, because what is being said, and everyone's really very convincing, everyone's very pedagogical. But when I go back on Monday evening and I see my friends at the cafe and they say, you were next to talk about AI, but then why are you full of hope? Yes, thank you. Well, I'm full of hope because these are young people. Before, at the Rencontres d'Aix, we used to talk about our children. Actually, now for most of it, it's our grandchildren. Our grandchildren need to be encouraged to develop training in AI of any kind, regardless of their intellectual capacity. And this is one of my questions about training. We've all got an action. We, as the elite, we all have grandchildren who are amazing, but we need to kick them up the backside and get them training. And if it's a good thing if they get trained in AI. Do you want to add something, Jean-Paul Mazet? Yes, in terms of the question that we had, I think transparency is really important. I think that businesses that are going to use AI, it's really important that businesses that use AI maintain control of algorithms, and that we can explain to our clients what we're doing with them. This transparency is a factor of confidence for clients. Clients need to understand what we're using these algorithms for, how it gives us such and such a result rather than another result, and how the staff of financial institutions are using these and are augmented through this. Ada? So if we could come back to what we could do to improve transparency, this brings us to this question of the fact that AI is not inevitable. It's us that created AI. It's therefore down to businesses to put in place the standards and the governance of this. businesses need to discern. Discernment is something that belongs to humans. Humans need to discern the rules and models to put in place a framework for using them. If we can't put in place rules, and here in Europe we are good at regulation, so we really need to think about how we can put in place supervising frameworks in businesses, because financiers need to educate the general public. If you think about the fact that 70% of Generation Z is ready to invest its money to an advisor robot, that helps you to understand how much financial institutions have to do in terms of education. And it's not just about managing risk in a standard business, but it's managing the risk of future generations. David. Yes, I was talking about the 3 pillars of confidence earlier, and I think in the financial system there's also the sequencing of AI deployment. The more we have algorithms, the more we create automated situations, the more we're going to have the kind of risk that Jean-Paul, you were talking about. So I think it's going to really be very important to have a development phase, or really limit this constant development of machines, that particularly in the financial system, particularly in the context of international connections. So in France, it might not be in the capitals market, but in other markets, because if everyone needs to sell at the same time on a market when everyone's got the same database and that give us collectively the same answer at the same time, we might get that result that you were talking about earlier, Marie-Pierre. Another question, very fast question. Yes, I represent a group of African press called Financial Africa, and as you know, in Africa, investment in finance should make it possible to really see significant progress. But I want to give you just 2 examples. Would AI in finance in Africa make it possible to, 1, reduce risk analysis, which means that there's been an overestimate of risk in terms of African countries? Would it be possible? Would AI help us to reestablish things, rebalance things out? And then also the second thing, this idea of fiscal evasion in Africa. Could AI help us to avoid this? So I'm going to try and answer the first question. This African content with a lot of potential. There is a risk of instability, political instability, fiscal instability. I'm not sure that AI is going to make it possible to address these issues, which are linked to confidence and visibility, which are the sources of confidence. Confidence and visibility is what finance needs. So I'm not convinced that AI is going to help us with the first aspect around the financial questions in Africa. Thank you very much. Our time is up. So now it's on to the next session, and have a great session. Thank you very much.
Bonjour.
Hello, everybody. Very happy to welcome you on this controversy on the housing crisis. We'll talk about the difficulty of finding housing. We'll talk about poor housing, energy renovation, and see if the building of new housing is the solution to this housing crisis. Also, I'll introduce Maya Teague, our two participants. You're the Director General of the French Banking Federation, bring together all the French banks, and you, Olivier, the General Director of the Caisse des Dépôts. Your nomination was approved in July, just now. And I'm Laurent Mauriac. I'm the founder of a media called Brief Echo, aiming at having a pedagogical approach on the economic activity. So you're involved in the question of housing, the SBF, through the financing that your members, the bank, grant to enterprises and households and families, and to buy housing either for rental purposes or to as an household, and the other Eurofunders. So before we respond to the question if building is a solution, let's do a diagnosis of this crisis right now. What are the characteristics to highlight? I think that the crisis in the building of housing, well, housing has become too expensive. If you look at the last 40 years, the price of housing has been multiplied by 12 and income by 5. So you have a curve that's really, so housing has become too expensive. So the reason for this cost is multifactorial. There's the price of the real estate, that's half in the price of the housing, and real estate is rare, so it's scarce. The mayors have problems in delivering building permits, and regulations. European regulations have complicated things, and the costs have risen for the people who want to access property, and for investors who think it's too expensive with a view to the profitability or to the return on investment. It's a European crisis, and led the European Commission to have someone in charge of housing. So these are the roots of the crisis. So you're talking about accessing ownership, but in the rental market, there's also a problem of cost. What's the consequence? That if you don't have enough housing that are built, so you have a phenomenon of raising costs. The costs rise. If you have new housing, well, the system is blocked. Maya Teague, thank you for the invite to this discussion on a topic which is at the heart of the everyday life of the French people. If we use economic savings, there's an imbalance between an offer that is much lower than the demand, which has increased in a dynamic fashion. You also have the recomposition of families, a change in the way of life of the households. We have students here, but even the students, I'm always very surprised to see students who live in a city except to do a special term elsewhere, and sometimes they need two housings, two apartments, and so there's very strong pressure on the offer, and the renovation also, which is not following. So there's also another cause. If we talk about the most recent phenomenon, is right after the COVID crisis, we have the higher costs in the construction materials, a lack of skilled workers, and the interest rates that rose drastically, and following the invasion of Ukraine by Russia, and all this raise in the rates led to a discrepancy between the buying power for housing and the banks that I represent. We have a lot here at the Rencontre d'Aix. They say that we fight to lend money to our clients. So there's a will to lend money, but with corresponding rates, and these rates have increased much faster than the buying power of the clients. When you look at the housing park in France, there's something that seems contradictory. On the one hand, you have a difficulty to access property and find housing, but on the other hand, you have a lot of vacancies in housing. And the number at the beginning of 2024 is 3.1 million apartments that show vacancies. So it rose by I don't know 60%, I think. So is there a way to address this contradiction before anything? The problem is the location of these free housing. They're not necessarily where the people want to live. And there's this notion of stressed areas with unstressed areas. We have low-income housing offers in some rural areas. We work on the territories. You have empty housing apartments, but people don't want to live there because there's no work in the area, or we talk about students, there's no university offer. So the problem of stressed areas, those around the metropolis or the large urban areas, where the only solution there is to build because there's nothing vacant. Is there some houses, some apartments that could be out to rent, but where the landowner, for example, prefers to keep the apartments vacant? Well, if you go into the touristic areas, and that's an issue, you always find people who say the problem, it's seasonal rentals. Housing that's apartments that are purchased only to rent during the high seasons. Well, it's a share, not that large, but it's linked to places where there's a big stress. So on this market, there are other elements that explain the cost of housing depending on different places. If there's a very big stress, well, the prices are higher, but it's not necessarily due to seasonal rental. And there's the poor housing also issue. People who live in apartments that are hard to heat in the winter or to cool in the winter, in the summertime, like now. Is there a contradiction between renovating or building? Should we choose between both, or we're full low-income housing? It's clear, but the problem is being addressed. What you call those places that are hard to heat. It's less than 5% today, and things have been fixed. So for the low-income housing, a lot of investments were done on thermal renovation because the regulations imposed that. I think we're at the end of that. And in the figures I see for the beginning of the year, there's new constructions are planned. We should go beyond 100,000 low-income housing built. And the French who live in poor housing conditions, the Fondation Abbé Pierre, for example, lists. Well, of course, we're talking about the poor populations. It'll be people who have access to low-income housing, and so we're building more. So there is a backlash. Obviously, the rates are high, but we have systems, which is the livret A, savings account, and the rate is very low, and it will still be lower because inflation is down. So we can lend at 2.4%, 2.4% rate. Very interesting. I think private client would be very happy to have that. So it's a rate that is for low-income housing operators, and I think that's a very good news. You have other systems that can be imagined to facilitate access. As the financier of 1.3 billion euros of that's the level private investments. It covers also some of the public housing. Yes, with the Caisse des Dépôts, It's 1.3 billion euros. No, 1,300 billion euros. And this covers 30% of the households, and those who have recently accessed a lot have used this credit. And so we try to cover how we can imagine residential paths. We see that the person who is very poorly housed, they will try to access low-income housing and then move to eventually access to property and so on and so forth. But it's very important to see the different elements of the chain. So we made propositions so that today's system to access housing be better calibrated, I think, on the territory. There's a problem with zoning, the different zones which are not well managed, and we don't necessarily. Sometimes we will consider as stress a zone which is no longer or it's no longer the case. So we have for the zero rate loans. We made a lot of propositions on the articulation between the zero PTZ loan, which is linked to renovation. And we also made propositions with other specialists in housing on the status of private donor and the status of private landlord. Well, the idea is they want to know, they wait because they wait for the new announcements from the next minister, for example, with lower interest rates or better options. So the private renter or landlord, the idea is to have a more stable system, stability of the subsidies, of the type of tax incentive that you have, or construction standards and regulations. That's really is key. What we see in banks today is that the people who hesitate to start renovating their housing, so those people hesitate because they figure, is this the right material I should use? Is it the right renovation I'm considering? So stability is really the key word, so that all these people can have access to quality housing. You talk about the residential path. First of all, I rent, then I access, then I buy my own housing. So isn't there a phenomenon of people who continue to rent for a longer period, and this eventually, since they don't move to accessing property, isn't there a phenomenon of a sort of like a jam, a traffic jam, a bottleneck, because they don't release the apartments for other people? Yes, it's a good diagnosis. It's a bottleneck. So 2.7 million French people have filed to have access to public housing. 100,000 apartments were built, but at that rate, it would take 27 years to fix the problem. But the apartments are not released. The people stay in the apartments. So we have a turnover rate with public housing, especially the people don't have access to other housing. They stay. They don't have access to private properties because it's too expensive. So we're stuck in this system, which explains that once the diagnosis was made, is building the only solution to housing crisis? Well, we say yes. Yes, we need to build more to satisfy this very strong demand. So we're saying 100,000 public housing built, or low-income housing. Well, compared to the previous years, it's a drop.
So this would be a projection of 20% up on last year. So the Caisse de Dépôt is doing more and more. So 10 years ago, we were building 1 in 5 housing units. Now it's 2 units, 2 in 5. When I go around now these days, I can see the cranes, and I count out these cranes, and I think two out of the 5 of these cranes are ours that we're funding. So we're 2 out of 5 in terms of funding, and what we need to do more, and this is our role in terms of social cohesion. We work in intermediary housing, and we're going to add 30,000 intermediate housing, and we've got 100,000 other housing units, so 130. We announced last week some student housing. There's a lot of demand for this. We are going to do 75,000 student housing units over the next 5 years with another developer. So 75,000 is going to be 50,000 social student housing. And then we're going to have space as well for the elderly in retirement homes. We are an aging society, and that means that older people are becoming dependent and they can no longer stay in their housing, and that's something that also needs to be funded because there's a demographic transition as well. Do we need to go beyond that? Does the Caisse des Dépôts need to start funding or financing 3 or 4 out of 5? I'm not sure we really want to go there. That's not where we want to go. So if I understand correctly, for you, Olivier Sichel, the solution is construction, and for you, Maya Atig, the solution is not just construction, but there are issues associated with the fluidification of the market. I'm trying to create the controversy here. Yes, I think there are a number of subjects of debate issues in this area of housing, but I think between us, actually, there's not very much in terms of disagreement, because today we have a lot of people who understand the housing sector, and we understand that we can't just keep passing responsibility to someone else. We're all too weak to be able to have to just work on our own and accuse others. So what's really important is that we work with a whole number of different levers. Construction is good, it's important, but we can see with what's going on around the world, this can affect all kinds of things. We need to really streamline the market. We've got a whole number of people that can do this, and this is something we want to do very much with other people. And then renovation is a subject that Olivier Sichel has worked a lot on personally. This means working with a number of different technical professions. We were talking about students. We were talking this morning about we've got an architecture student whose father doesn't want to build anymore. So this is an architect here who's thinking about reuse. So we've got a whole number of different levers, but construction is 291,000, and this is 25% less than just a few years ago, and this is a real collapse. So what we can't change society. We can't tell people to stop separating, and in couples to stop separating. We can't tell people to stop aging. So we really need to use all opportunities to provide a solution. The final issue I wanted to raise with you was about distance from place of work. Policemen, nurses, teachers who work in the center of Paris, for example, where rents are really just extravagant. What solution can we put in place for them so that they don't have transport times of an hour over to come to work? Well, these are issues that we're working on, that we really want to work on. We're working with big employers, the PHP in Paris, and also with the national police force outside cities, also with the post office and EDF, in order to find suitable solutions. We're really seeing progress. We're starting to put in place systems between social housing and intermediate housing, where we break up property and we own the land and they own the structure, for example. But what we can see is that there's been something that's been amazing. There's been a real opportunity that's offered, not for policemen or for nurses, but for a number of tertiary workers who have this opportunity to work remotely and to go to cities and to do remote working. So we've worked hard to make sure that there is an ultra-fast, there's a high-speed internet network all around the country. We don't talk about that anymore, but that's really made a real difference in terms of everything that's happened in terms of COVID and the development of medium-sized cities. There are people that are saying, well, if I'm being asked to go to Paris just a couple of days a week, I could go and live somewhere else, where I might find a market that's more relaxed, that's more accessible, where there's green areas, where there's cities with an interesting historical heritage, and there's a way of getting out of Paris and metropolitan areas. This is an opportunity for some kinds of jobs, but of course it's not for professions that need physical presence. Yes, of course, I was thinking of those professions that need physical presence. Do you have any ideas about reforms that might make it possible not to resolve the housing crisis, but to somehow reduce it. Thank you. Well, I want to talk about what might seem a very technical aspect, which could have a really direct impact. In France, we have fixed rate loans, primarily fixed rate loans. That's not the case somewhere else. The market has organized it, set itself up that way. It's a system that is really very favorable to borrowers. And since there's a strong competition between the banks, this pulls down rates. So fixed rate mortgages that are low, and so when the overall rate went up to 4%, the banking rates just went up to 2.5%. So in terms of for buying power, that was a lot in terms of consumers, but in terms of what other countries are experiencing, is a lot less. It went up much less, and monthly payments stayed fixed. So in France, when you borrow for maybe 30 to 35 years. At the end of your life as a borrower, you pay the same amount in euros and centimes. And so this is a system that is really not known in very much in other European countries. And it means that today there is going to be a European Commissioner for Housing, but our concern at a banking level is that a European banking supervision might not take into account the national specifics of the national market here, and it might encourage the French market to no longer be on a low fixed rate. We can see, and you as customers don't know this, and that's a good thing, but there are an increasing number of restrictions within banks in terms of loan management because they are seen as too favorable to borrowers who are not taking the risk of variable rates. So we have some signals in terms of social housing where there's been some recent improvement, but we've really had to fight to show how social housing works in France. So these are technical aspects. So it's really very important to have a European commissioner who respects the specificities of different countries and that doesn't create other constraints on top of the other situation we're facing. How about you, Olivier? Well, of course, we're talking about, in terms of building, constructing, how are we going to find land to build on? So here's some good news for you. Last week, I was in Grande-Sainte. This is in the suburbs of Dunkirk. This was last Friday. There's a nice breeze, a cool breeze. We went in the north of France. It was really cool. It was amazing. And just thinking about that, I just feel really nostalgic. But in Grande-Sainte, there's a big shopping area. We're in the north of France, in this world where ocean dominates. So sometimes these are called a bit ugly, these shopping centers with Leroy Merlin and others. And this is a shopping center that's not performing well. And the idea, together with the Auchan Group, who owns the land, the idea is to rebuild the city without developing this artificial land, without laying more concrete, because they're seeing that they don't need any more of these huge car parks, etc. And so Dunkirk is developing with the development of the port, and so there's not much land left, but we can reinvent the city, and we're doing that with a number of different partners, thinking about how we can transform the city, thinking about how to recreate housing and get rid of that ugly side of France. So that would be a really good thing. So here you're thinking about building, but not in virgin territory, but in areas where there is already buildings, as it were. Well, thank you very much. Thank you to both of you. Thank you.
Mesdames et
Hello, ladies and gentlemen. Welcome to this roundtable dedicated to essential key question: can we still support a drop in buying power? Well, after inflationary shock, the question of buying power is main concern for the French people, for corporations and public decision makers. Growth is slumping in Europe and inequalities are greater. How can we preserve social cohesion and how can we re-trigger the economic dynamism? What answer to bring to uncertainties? To fuel our reflections, I'm happy to welcome our participants, Valérie Rabault, former Vice President of the General Assembly and former reporter of the General Assembly, the first woman, Clément Laurie, Director General of Airbnb, Serge Madeleine, Director General of LCL, and Gilles Vaquet, President of BNP Strategy. It's an honor for me to animate this round table along with Pierre Becquet from the Cercle des Économies. So before handing the floor to our discussions, we'll hand over the floor to Pierre Doquet, who will shed a macroeconomic light on the dynamics of buying power in France and in Europe. Pierre, the floor is yours. Thank you for giving me the floor. Yes, as you all know, buying power is the first concern of French people. First comment. Second comment, and a question that is addressed this way, well, we can wonder who is us that we need to support, because it's not a unified people or population. It's clear that it's not the same people who benefit from these actual situations we're faced with. So I'll try to develop 4 points very briefly in a nutshell because we don't have much time. The first point is just an observation. First surprise is when you look at the INSEE statistics, the buying power has not dropped in 2021, 2022, up to 24. Yet it increased a little. So some people use this as a pretext to say, well, it's just something that's felt. It's resentment. It's the obligatory expenditures that are felt, as rising. But it's not only that. Remember that buying power is what INSEE calculates. It's an average. And so consequently in the buying power of the French people, there's the buying power of based on salaries and wages, and the buying power of housing, ownership and capital. And we see that between 2021 and 2024, the later have increased sharply because they took more than 17% over these years. It explains why the buying power seems to have increased. But in reality, I think you have to take wages, salaries. If you consider wages, the buying power based on real salaries, things change because following the rise in prices and that everybody suffered from, the salaries were raised, but less than prices. It's very different. So the salaries were raised, but still less than the situation in 2021 compared to the cost of living. Well, there are salaries vary a lot, of course, but globally salaries dropped. And all indicators, of course, in all surveys show that for lower classes, there was quite an important drop compared to the other categories, a drop in their buying power, with situations of people become poorer because of the cost of energy and the cost of foodstuff. And so we had problems with the heating bills, debt, food. We know that a lot of people went to one meal a day. So I don't want to go into that description, which is a tragedy by itself, but that we know quite well. This said, on this buying power that dropped, never forget that in the past years there was the trauma of COVID, and what happened is that for wages it dropped a lot, problem of unemployment, but they caught up to that. But the trauma stayed, and extremely strongly, and one after the other. Well, it makes people feel that they're living through a tragedy. First point. Second point is what will happen in the short term. We run the risk of seeing our buying power drop because of the inflation or because of the austerity policy. For the inflation, two things. We'll go back on that for sure. But the first is that there can be exogenous shock due to a war, for example. It's obvious, epidemic or what have you. There can also be more structural type problem. I think that we're still in a situation, in particular in Europe, where there's a lot of savings compared to the investments carried out. So there's a trend to lower the rate of inflation. And then there's the austerity policies. The risk of having such policies is clear. And we talk about that every day. My third point, and the fourth, just to satisfy you, the third point is what are the structural causes in the long term, in long run, and what we should do faced with these structural causes. They're well known, they're real, they're a fact. There's a problem of productivity and distribution of the productivity gains. So it's these two structural issues in the long term. So we need to have a new policy for offer that would have nothing to do with the price competitiveness or salary competitiveness, but which in fact consists in making investments and innovation. And we need a policy that will change the distribution in favor of the labor income, which is much lower than what we should have. And I will conclude here. Okay, thank you, Pierre, for this setting the stage or the scene. And I turn now to Valérie Rabault. As a former Vice President of the General Assembly, you have a very precious experience of public policies and the stakes of redistribution. According to you, what do we need in terms of social policies to protect the buying power of the French people? It's a presidential program you're asking me to describe. So 2 or 3 points. To react on what you just said, you know that when you're elected, your co-citizens come to see you on different topics, and it's clear that buying power has become the #1 topic, which wasn't the case. It was the case in 2012, 2014, and then there was a drop, and it became again the topic #1 of the concern of our co-citizens. And we look at statistics, 82% of the people say that they were going to do some more savings, otherwise we can't manage to, at the end of the month, to meet our bills. So a lot of people are in the red at the bank. So we learn a lot by looking at bank accounts. But so it's the first topic. Maybe the #1 topic is the worries linked to war, what's happening in the international context. But #1 in France is buying power. Maybe with access to health care being practically at the same level. But is French in a specific situation? Maybe not. There is the Eurobarometer, which is a survey that is launched every 6 months by the European Commission with 26,000 people. And we see that France is part of the countries that respond the most It doesn't mean that the people in other countries don't have problems with buying power, but maybe we're more sensitive to that aspect. When you look at Eurostat data by quintile, we cut up the population in 4 quarters, and we see how things have evolved since the year 2000. We see that the buying power for the first section is the one that has the least progressed compared to other countries. It gives a situation to say that there's a feeling of becoming poorer or losing in buying power in this. And the other problem is the constrained spendings, with our at 26% now, but with situations that vary according to your revenues, your income, that can go up to 40%. So all this lined up, it's quite a difficult cocktail when it comes to the social cohesion, how we consider ourselves and the value we give to our work. If you're in the red at the bank on the 20th of the month, while you're working full time, it means that there is truly a difficulty on the representation of work. So there are structural causes to this, and one that appeared since 2019, that has amplified since 2020, is the drop in productivity in our country. We always said, we always considered France as, we have 35 hours, maybe work less, but we work better. That's what we had in mind, that's what we thought, that we believed. But all this is wrong since 2019. Since 2019, we're in a situation where our productivity drops regularly. And this must be considered very seriously, because it means that in the end, we work, but we don't produce enough. We're not as efficient in our work. And I'm sorry that it's never discussed in the public debate. Productivity is based on... may I maybe ask you a question? Don't you think that because there's discomfort at work, a lot of French, when they talked about the retirement reform, people said that they were unhappy at work. Doesn't that explain this discomfort? It has to be taken into account. Here in Aix, at the Rencontre Économique, while we can meet the general managers of large corporations, they say, and you, how do you see productivity? And politely, I will not reveal who told me that, but this person said in 2019 we had such a production rate with so many employees, and today we have less productivity and we have more workers. So this is an example. Just do the test. They interview different general managers that are here at the Rencontre. So this should be a collective reflection. It's really, we should address this issue. If we want to take up this challenge of the buying power, we need to really have a better mobilization that will involve politics. The second aspect on buying power, when you talk about a drop in buying power, you have a consumption that is dropping. Less imports, okay, that's good for our commercial balance, but as it is in France for the creation of wealth, and it's not the question in Germany, 60% of our wealth is created by consumption, massive figures, 20% by investment and 20% by foreign trade, by exports. That means that if the engine of consumption is hindered, our creation of wealth is also hindered. Germany has a different model. 40% of its wealth creation is on consumption, 40% on exports, foreign trade, and 20% on investment. And so you see that we're very closely tied to this question of consumption, including for our production of wealth, which itself means that our GDP can grow. And we have less budgetary efforts. When you have a high GDP, you have less budgetary efforts to make. And this aspect must be considered at the micro level. I gave you examples on productivity earlier. But you know that today in France, the fiscal indicator is the reference tax index. It's a reference for the calculating the different, for example, mutualist insurance and all that. But I think today we have to consider what bankers look at closely is what the left to live. When you have people who are in the red, or people who finish the month with 150 euros at the end of the month after paying all the bills, well, there again, it's a difficulty. I think that we need to have a finer means of regulating this. And today we have the means. You can put artificial intelligence to analyze the data. We have a better capacity to have a much better understanding of the situations that what existed in the past. We don't use those tools, and it's quite regretful. And on one important aspect is that when you have low salary, you can have a bonus. Today you have a threshold effect, and you have people who say, "Oh, I don't want a wage increase because I lose my housing subsidies and everything, and I lose in buying power." So we have to smoothen all that. We have to, instead of having a clear cut. And I think we have to be smoothen the situation. If you have €1 of subsidy, it shouldn't hinder the other subsidies or allocations that you get. And with the computer tools that we have, it's really possible. I turn now to Clément Oli, Director General of Airbnb. You will share with us your vision of buying power through the prism of tourism and collaborative economy. Please explain how this sector can contribute to support the everyday life of the French people.
Well, the buying power is associated with salaries, of course, and the question really is what's left after all the bills are paid. I think what's important is three things. First of all, let's continue to make it possible for French people to take initiatives, to put in place initiatives, because they want this. The second thing, there are budget items that are so important that people don't want to see them reduced. So, for example, not going on holiday, because for the French, holidays is not just an accessory. And the third aspect associated with having money to live, and this is associated with all French people across all French territories, so that creates social cohesion. So if I develop these questions, it seems really essential to me, and I can see this from the 600,000 hosts that welcome travelers on Airbnb. I think it's important to understand that we've got people here in the room who do this. Hosting is an activity that makes it possible to take initiative, and taking initiative and sometimes causing reducing this possibility to take initiatives prevents people from moving forward. 92% of properties are rented occasionally, and it helps French people to increase their buying power by up to 4,000 euros a month. So that's like an extra month's salary. So it covers half of what most French people say they're short of. And so it seems important to say that these hosts, 60% of these hosts say they do this in order to pay their monthly budget. So it seems important that buying power is, of course, linked to salaries, but also linked to being able to take initiatives, extra ways of generating income which impact their daily life. If we think about the travelers who are coming to stay with hosts, 40% of the French don't go on holiday. And when we ask French people about the week that they go on holiday, it's a week where they get to breathe, where they get to disconnect from daily life, where life is just going too quickly, where often we're not connected to each other as a family. And the goal is to reconnect with friends and family during this holiday period. And so when when you ask people about their holidays, they say, well, we reconnected during this time. And so in terms of buying power, it's about what we can do with this buying power. And sometimes I think people don't understand how much holidays are important for people in France and for families in France. When we know that 75% of the French are willing to spend less on clothes, for example, or other daily budget items in order to still be able to go on holiday. When I can see that a third of the French say that they go on holiday less than their parents, and it's about 50% in the north of France. 50% of these are also among working classes. 50% of these are women under 35. So we know the importance of reconnecting, making a commitment for holidays that are affordable and open. This seems like absolutely essential, because when we have a kitchen with rooms around it, for example, that makes it possible not to have to go to a restaurant, even if that's a very agreeable thing to do. But it helps us to spend less money. The third point is that this goes beyond families. It's also a territorial question. Of course, when we think that of holidays as a luxury, it's even more the case in rural areas. 8 people out of 10 in rural areas consider that holidays are a luxury. This sense of losing social status, losing class, is linked in to this whole area, and it's important to be able to generate additional income and to make it possible for the French to have a holiday experience somewhere else in France. That's really very important. Here we're talking about affordable tourism, affordable journeys, and I'm really delighted to see that this dynamic of family holidays in rural areas, so away from the coast, this is a really strong focus on this, at least on our platforms. I think that's something that's really fundamental for this link, for this tie that's between us, for the relationships between us. So how can we make it possible for French people to develop their buying power, continue to be able to take initiatives, go on holidays, stop preventing people, stop putting useless obstacles in the way, because people need to be able to breathe, they need space, and we need to make it possible for the French to breathe. Thank you very much, Clément Ulrine. We're now going to turn to Serge Madeleine, who's the Chief Executive Officer of LCL. As a banker, you can see people's expectations in terms of their incomes and buying power. What do you think you can do to help people preserve their buying power? So the theme of this event this year is about facing the shocks of reality. That means if we're going to do that, we have to put in place solutions that's not just about doing a little bit more and a little bit better. So that means disruptive solutions. So we've heard from Pierre Doques to solutions about gaining in productivity or better distributing wealth. I think the system is broken and we need to develop a new system. I'll tell you why. Because if we look at the development of production costs, which drives consumption prices, for the last 60 years we've been globalizing. That means we're producing in countries as far as possible in order to have a cost that's as low as possible. In Europe, in Asia, so that makes it possible to reduce production costs and therefore increase consumption. But today we've got an inverse system going on. We are de-globalizing now. So there are 3 reasons we can't continue to globalize, because there are planetary limits. We can't go round the planet twice. We've gone as far as possible. Also, for environmental reasons, it becomes a really terrible thing to get something from elsewhere that we could get from Aix-en-Provence if we in terms of carbon costs, but also for strategic reasons, geopolitical reasons. So we're going towards a de-globalization. And the thinking is as follows. If globalization made it possible to reduce production costs, it's likely that de-globalization will lead to a structural increase in production costs. that's what we call trying to put the toothpaste back in the tube. So I think that in the coming years, we are going to have a structural increase in production costs and therefore tension around buying power. And so this system that says, well, we just need to add public spending to help people to spend money, or let's tell businesses to focus on productivity or to reduce their margins, I don't think that's the solution anymore. With LCL, we've just met 10,000 entrepreneurs around France, and I've really been struck by the value of entrepreneurship in France. Just a few figures here. Last year, 1,100,000 businesses were created in France. Nobody's talking about that. That's 4 times the amount of 20 years ago. The added value of these businesses, I'm just talking about micro businesses, self-employed businesses, the added value is 450 billion euros. I'm wondering how we can improve that. And I've got 3 proposals in that area. The first proposal would be an entrepreneurship passport. All young people, when they're 18, they receive a siren number. I suggest that they all receive siren numbers so they can become self-employed. They can work as self-employed. So, of course, not everyone is going to take advantage of this, but it's going to give them an opportunity to have their business. The second is a solution of gender equality. Even if we create 1,100,000 businesses in France, 2/3 are created by men, 1/3 by women. Why is that? If we encourage women and we put in place positive discrimination and we come back to equality without impacting the capacity of men to create businesses. If we have a 50%, that would increase. We're seeing an increase of 32% of added value. So that would give us another 150 billion euros of added value. That is 2 percentage points, 2 GDP percentage points in France. And then in terms of buying power for the future, I have been an entrepreneur, and I remember that when I started as an entrepreneur, I was refused a mortgage. So not only I couldn't develop capital for my pension, and I couldn't borrow either. So I suggest we should organize a system, a guarantee system for mortgages for entrepreneurs, which would help them with their buying power at pension. So these are 3 proposals that don't involve redistributing wealth or increasing productivity, but increasing the value in France. Thank you very much. Now let's turn to Gilles Vaquet. You support a number of businesses in France and around the world. What can we do to increase growth in this very uncertain field? Well, this is a vast subject, but I think it's very clear in terms of buying power. I don't know if for a lot of the population, even if they're fairly stable, I think a lot of people are struggling, and we need to think about how to redistribute. What I think shocks me is the elephant in the room is that how we can better distribute, or how can we create a better cake. I think we can always be inventive, and I think we need to think actually about the size of the cake. And I think this is something that really shocks me. For the moment, I think we don't really realize in France and in Europe, the world economic market is moving forward. We have this impression that nothing is growing, there's war, etc. But actually today in the world, even the United States have said they're at 3% over the last couple of years. India is at 9%. It's only Europe where we're seeing problems, and in France as well. So following what you were saying, Serge, what we need to do is expand the cake in order to better to distribute it. And that's what interests me. So how long is this going to last? Is there going to be another crisis? But while the worldwide situation is, of course, disrupted, but economically it's good. Of course, it's poorly distributed around the world. That's not what I'm saying. But could we capture some of this and develop the French economy? That's what we're here to talk about for Europe and France. But in France, we have a whole number of different advantages. We have people who are well trained in areas that are developing for the future. We're good in defense, we're good in energy, we're good on infrastructure. We're a whole number of sectors. We have a whole amount of know-how. So how can we, perhaps like the Germans, perhaps, I don't know if we need to stay at 60% in terms of growth or just expand exports. So if we're talking about that kind of development, then we need to invest in future industry. But we've got no money, so how are we going to do this? So the real question is about how can we develop investment capacities in areas and industries that are going to develop in the future, where we have a lot of opportunities, and France really could do something. And I really believe in the worldwide economic system to distribute this. Of course, we were talking about this in the panel session this morning, but something that we don't work on enough, and investment funds are often seen as the bad guys here in France, but generally in France and in Europe, we don't have any private equity funds. We don't have any capitalization. In the United States, it's 150% of GDP. 35,000 billion is the pension funds of Americans, which is invested all around the world, not just in US. It's in the United Kingdom, it's 100%, and in Europe, it's 32%. So I know that pensions are a big issue. It's very complex, and I'm not saying it's the solution. But if we could do a hybrid solution, if we had a capitalization system which was safe for people who paid back, but I think this would give us a dual effect. It would make it possible to guarantee the pensions of French people. It would also give us investment capacity. We could invest in energy, in defense, in energy, in AI. And I think the capacity that we have, if we could do 100% of our GDP, that would be 290 billion. And so we have the skills. Things are moving forward, and I think we could advance and make progress here. Thank you to all of you for these initial thoughts. Now we're going to open up debate around three key questions going on in society. So first of all, what do we need to learn from the drop-off in buying power, even though Pierre is saying there isn't actually a drop? And then could an austerity policy worsen the situation? And also, do we need to refocus our growth model by focusing on investment rather than consumption? So let's start with that first question. What should we do about the drop-off in buying power?
I feel like saying, the glass half full. I want to talk about all the companies that enable to limit the drop in buying power. Which company played the game, in fact? We're talking about the tariff shield. We're talking about energy companies, Leclerc and all. But the companies that really enable to maintain the buying power of the French people from 2020 to 2024, it's the banks. Explain why. Who has housing credit? Okay, practically half of the people in this room. What is how did your monthly payments increase while the interest rates were raised by who had an increase in the payback? Well, why nobody? Because the banks absorb, thanks to the fixed rate model. They absorbed 450 basic points. I calculate that only for LCL it's 4.5 billion euros per year that we gave back to our clients, like BNP, like Caisse d'Épargne, in terms of buying power. And this is not said enough. The model of the fixed rate property loan is really an important model. Ask our Italian and Spanish colleagues and friends, and they'll tell you how much they suffered. The initiative taken by the French is perceived by the significant increase of the rooms rented through Airbnb. When a teenager leaves home, just to go study somewhere else, we can rent his room through Airbnb. After the COVID, 25 of the rooms rented are done through our Airbnb, just to, of course, to increase one's buying power. A lot of people who are hosts to rent their rooms, often they're retired people, bachelors or something like that. They do that to raise their buying power. It's a way of better using what you own and enabling you to live better. And that's the purpose. We saw a large increase of the rooms rented by individuals, by private owners, in a period of high inflation. So an anecdote I'd like to share with you. I was in an office in New York. We have a seminar in Hudson, in the countryside, the U.S. countryside, and we're there on the night of the election of Trump. Next morning, I took a cab, in an hour and a half, and I discussed with the driver to try to better understand why a taxi driver was happy. He had the MAGA cap and everything, why he was happy with Trump. And he said, well, do you understand? You have to understand that we're in an economic crisis. I said, the U.S. in an economic crisis, 3% growth rate, and everything was happening. Well, you saw the inflation. The inflation is double what we had in France. So I chose a candidate that will launch the economy again, increase the incomes. And it's the taxi driver that told us. I don't think we have that mindset in France. It comes from education, it comes from entrepreneurship, it comes from how we make the cake larger. It comes from a taxi driver. It could be entrepreneur. I was surprised, and that's not the vision we have here. Why Trump was elected, in the U.S. They have a debate on producing at home and everything, creating jobs at home and develop their economy, and they have that in their DNA. And the loss of buying power is different from country to country. And I think, like Serge, there's a lot of energy here. No caricatures here, but the capacity of freeing this and understand that we have to make the cake bigger, it's in everybody's interest. I think it's something that's not sufficiently explained. Yes, Pierre, do you want to add something on this example used by Gilles Baquet? On this question, I think we have to take a more historical position since middle of the 20th century. We're used to, thanks to growth of the buying power, each generation was better than the previous generation and lived better. And that's a problem that we could consider as really fundamental or essential or philosophical. Well, what's been happening since the end of the 80s is the questioning of this mode of living, historical mode of living, where we could hope, even if we were subject to a difficult period, we could hope that we'd be better for our children in the future, and that's what's being questioned. And it's dramatic, and consequently, if we were to end up with substantial drops and durable and sustainable drops in the buying power, we can be sure that there will be destructuration of society and the resources of the society as such will be questioned. So it's a major change. And I would like to add a point is that, in fact, we had, throughout a certain period, a rise in the buying power thanks to the drop in prices. And behind that, not a drop in the production costs as such, but thanks to globalization that enabled to buy T-shirts, jeans, what have you, all that coming from China or elsewhere. And this opened the way to maintain or increase the buying power. You must see that people benefited from that. But at the same time, this same phenomenon destructured the production systems of former industrialized countries. And we're in a situation where Europe is losing its last industries, old type industries that it had. Germany, for example, is losing its automobile industry and everything. And it just let all the recent industrial revolutions go by. So it's very important to find another model where we will replace with wages or salary increases. We lost them. We lost it because and we found it. We had it with the drops in prices. But Valérie Rabot, I turn to you. I'd like to have your opinion on this aspect. French political women, are they aware today that of the importance of this question of buying power? We're under the impression that it's not really well understood today. And I'm not going to talk for French women, but I think they're aware of that. Are the structural causes well analyzed in the public debate? Go back on what you were saying, both on the fact that we're faced with change in paradigm, very powerful, that is not described as such. Roughly speaking, our economy was based on low cost of capital, very low rates. We know the rates raised since COVID. Labor costs, since we were buying everything from abroad, in Asia, for example. Well, the labor cost was where the labor cost was very low, and it was reflected in prices. And the other aspect which is important is the energy costs. The cost of energy, we're protected in France because we have a lot of our energy is produced with nuclear fuel, but we're faced with these three revolutions on the cost and prices that we need to face, and which presupposes that we need to redefine our European production model. I'm sorry, but I think it's important to know if today the political class that is in office, are they aware of that, of the main question that concerns French people? So is the question really well heard by political representatives? But it's good to know that there's a problem. In politics, well, we try to solve problems, find solutions. But is there a consensus on the causes? I don't believe that. There's not enough debate. Also, the different political options that exist. Highlighted three problems. Are these problems addressed? Are there options, solutions? No, because you look at the political programs, they're empty. We're not facing the world as it's transforming itself with a real good sense of awareness of what's happening. We can say Europe. I have faith in Europe. Europe was built from the Second World War by organizing its internal market, and so it's the competition that took the lead in Europe, trying to lower the prices, even if it meant to the expense of our own production means. And what's happening in the U.S. and in Asia, we have to reorganize our relationship with the rest of the world through trade and through what we can produce in our countries, on the European continent. So these are major changes, as if you took in the 70s, for example, 1970s, when there was the oil shock and everything, which they decided to change our way of producing electricity. It was this shock that's at that level. Important decisions need to be taken, but are not part of the public debate, I must admit. Another question, talking about the austerity policy, 40 billion euros savings for the fall budget. And will that make the situation even worse? Who would like to Serge, yes, I think what will make the situation worse is not to do savings plans. What we call austerity, I call that reality. It's a reality. Can a household spend more than what it earns? Can a company spend more than its income? No, it can't. Sylvia Baquet, who doesn't agree with this, but in the end, well, the state is exactly the same thing. And I think, in fact, we will not steer clear from a savings economy, but we will have to do that by selecting the economies in the light of the impact it will have on the buying power, trying to minimize this impact on the buying power, notably over the most less favored social classes. Very important. Otherwise, we run the risk of really suffering. And what we seldom do is to evaluate the positive impact of these savings, as we do in corporations and in businesses. Yes, I think I agree. The question we have is short-term versus long-term. Economists seem to be quite unanimous when it comes to austerity policies, with the deglobalization, defense, and everything. But we know we have to make efforts, and these efforts can pay in the long run. Pay back, and the capacity that we have of making efforts that are bearable, so that tomorrow we can have a better world for our children. Go back on what Pierre was saying. I don't know if collectively, in the debate, in the public debate, in the media, for example, are we ready for that? I don't think we're mature enough for that.
Do either of you want to reply to that question?
7 minutes.
Micro for Clément. Microphone for Clément. So, in terms of the question, I don't know what the government's going to put in the 40 billion that's been announced in the press. In order to give you an order of magnitude, the public deficit that we have, if we look at a household with 2 children, it's as if you were ending the month every month with in an overdraft of 547 euros, and that's tricky, but that is the reality. So of course things can't continue in that way. So the state can't be compared to a household, of course, because it's not the same situation. But the order of magnitude, if we imagined all of us, if we every month had an overdraft of between 130 and 530 euros, that's what the public deficit is like. So there's a question about the management of the public budget, which cannot continue forever as it is now. In a finance law, there's always an introductory article which no one reads, but it gives the general balance. And there were always two members of the National Assembly who put in place amendments, or perhaps there were 3 of them actually. I can see someone else here, and we put a few amendments in place, and it lasted just 10 minutes of debate, and after that we had 1,600 billion euros that were approved just after this small debate. So I think we need to change this. I think we need to have a real debate on public finances. We need to have this debate. I know that no one's really interested, but if we don't have this debate, we're going to end up, I've heard so many people say so often, we're going to have to just cut some things here and there. That's not a policy. We're going to have to target some things really clear, and we can only really do that with around a question of justice. We can't allow some people to continue to make amazing profits, or different areas that that are progressing in particular ways. That's really essential. Thank you very much. Our last question, just very quickly, because I want to hear questions in the room. So, in a word, should we build our growth model on consumption or on production? That's going to be very difficult in 2 words, but we're going to have to focus on consumption and also investment. We're going to have to focus on investment. So beyond the budget for 2026, which is going to be a challenge, I think we need a France 2030 business plan. How are we going to create added value? What are we going to renounce, and how are we going to make sure that the services of the state, the general organization and fiscality aligns with these advantages? Yes. I would also share this last point, because tourism is brings added value over the long term, and it is an activity that cannot be delocalized. And the other point would be reinvestment, how we use what is existing at this time. There's a kind of circular economy about making other people benefit from what we have now. Well, it's always really difficult to do this in just 2 words. Very briefly, the state and the households are very different in terms of debt. You said this, of course, but your argument presented it as if it was the same thing. No, the debt of the state and the debt of a household is not the same thing at all, and all economists of all kinds are in total agreement here. What I would just add as an argument is that there is a danger if we put in place an austerity policy today in terms of buying power. There is the risk, a social and political risk, because what you are going to bring in with this kind of strategy, these are deflationary strategies, that is going to lead to the rise of the extremes. And very simply, that's going to mean that in the presidential election, we will just have Le Pen against Mélenchon because of this. So think about social and political consequences before talking about debt. Thank you very much, Pierre. Are there any questions in the room? 2 minutes left, so thank you.
So, Pierre-Yves Maroli, I'm unemployed. I'm under the impression that in the French politics, because buying power is the first topic in France, we play to who has the best rule of 3. It's a debate of parameters, but we forget what's at the front of the schools of freedom, equality, and fraternity, which mobilize the nation, the collectivity, to build a state that's not the same as a household. If we abandon the level of vision we're talking about here to discuss on parametrics, so we're all heading for the wall. So what is your question? My question is why have we forgotten what is the value of France? Why did we forget freedom, equality, and fraternity? Who wants to answer this? Valérie Rabault, I will answer, because I wrote a book saying that the economic model is freedom, equality, and fraternity. Freedom is the risk-taking process, long-term investments by the state, and the short-term, the private sector. Equality is an important education system. Fraternity is being open to the others with shared public services, and the European politics that are open. I can give you the work I did. It's the France 2040 business plan. But it's the French model still that we need to defend. That is, that's the motto. It's on at the basis of our French economic model. Thank you, Valérie Rabault. Thank you all. This debate showed the complexity of the topic. Buying power is not just a question of figures. It's a question of perception, opportunity, and trust in the future. Thank you all. Good evening. Have a good evening.